This wasn't your typical hearing moment. RFK Jr. was left speechless as Cortez Masto demanded answers about the skyrocketing cost of life-saving drugs.
Senator Cortez Masto.
Secretary Kennedy, thank you for being here. In May, you said, and I quote, "I stand with President Trump to say, no more middlemen, no more foreign freeloaders, no more skyrocketing drug prices. We're putting American patients first and taking on Big Pharma to make America healthy again." Yet your record tells a different story. In July, Republicans handed Big Pharma a massive win. Their big, beautiful bill that they just passed shields billion-dollar drugs like Keytruda, the world's top-selling cancer drug, from Medicare negotiation. Keytruda has been on the market since 2014. It pulled in nearly $18 billion last year in the United States alone. It costs patients up to $175,000 a year, draining Medicare of billions and forcing families into crushing debt or to forego life-saving care. And yet you support the big, beautiful bill. So despite the hype with executive orders and Washington Republicans' only drug pricing law days relief for Medicare patients relying on high-cost cancer drugs, meanwhile, Democrats finally have allowed Medicare to negotiate drug prices. I will say that Keytruda, along with Opdivo, and Darzalex, the three top-selling cancer drugs, were widely expected to be selected for Part B negotiation in 2026 for 2028 implementation. They are now, because of the actions of this administration, exempt from negotiation for at least several additional years, if not permanently. So my question to you, Mr. Secretary, is how do you justify claiming to take on Big Pharma while supporting a bill that shields drugs like Keytruda and other cancer drugs from Medicare negotiation, costing seniors and taxpayers billions, and risking the lives of cancer patients who cannot afford their necessary medication?
Yeah, Senator, I appreciate the question. The Medicare drug negotiations in the IRA were very well intentioned, but they were poorly structured. And what we found is that there are actually, the negotiations that have occurred actually have ended up raising the costs for Medicare. We are right now in negotiations.
The CBO has not agreed to that. The CBO doesn't say that. And it's just the opposite. So you're saying the CBO and independent agencies that validate the costs are wrong?
Well, that is CMS data.
Okay, so let's just focus on the cancer drugs. Why aren't we negotiating those and bringing those down for families? Why does the bill exempt those?
It's part of the MFN negotiations. I'm not sure of that provision in the bill, of the one beautiful bill, but the...
You're not sure of the provision, the negotiation provision, and how exempted for
Keytruda?
Drugs? Your agency is responsible for that negotiation, and you don't know about it?
I know that we're negotiating in the MFN
Let me ask you this, Mr. Secretary. Let me ask you another question. How much are Medicare Part D enrollees expected to pay for prescription drug coverage next year?
I think that is in debate right now.
Let me tell you.
Are you talking about the rate?
They are going to pay $15 more than last year, up to $50 a month. Now, let me have a question for you on Part B. How much are Medicare Part B premiums expected to increase next year?
I don't know. I talked to Dr. Oz
that is about,
I think it's 16%.
They're supposed to increase about 11.6% or $21.50 more each month. And again, last time we were before me, you couldn't answer the questions of the very agency and the authority that you have to address these issues. You know, next year, seniors and families are facing higher health care costs across the board. 23 million people on Medicare with a standalone Part D drug plan could see their premiums rise to $50 a month, up from $35, because the Trump administration is cutting the federal subsidy that has been keeping costs down. Part B premiums will jump 11.6% to $206 a month in 2026, one of the largest single-year increases in decades. And so for an administration that claims it is lowering costs, my question to you is, what are you going to do to keep costs down for seniors?
I mean, I'm already doing I'm already keeping costs down.
What are you doing to keep costs down for seniors? knowing that these costs are going to be increasing?
I mean, the program integrity bill, that is the first action that I did when I got in. It's one of the earliest actions in history of a complex regulation by an HHS secretary. A Congressional Budget Office has said that that's brought premiums down by 5%. That is the Congressional Budget Office, which does not like to acknowledge anything that we do.
And does that impact seniors?
Excuse me?
Does that impact seniors? And I know my time is running out. Does that impact seniors? What you just talked about, you're lowering costs. I'm asking you specifically.
We're lowering
for helping
costs.
seniors. Does it impact seniors?
Does it impact?
Come on.
Let me just stop here.
I didn't
My
hear
time is
what
running
you
out,
said.
so I appreciate the chairman's indulgence here. My concern is you can't answer the questions. The very agency has oversight over these issues and controls the levers to lower costs for seniors. And you can't answer that simple question.
I didn't hear your question.
Okay, let's go.
This exchange wasn't just a heated back and forth, it was a real-time demonstration of why policy detail matters and how the difference between rhetoric and results plays out in people's lives. Senator Cortez Masto did more than score a political point, she forced a moment of accountability. If you promise to take on Big Pharma and put patients first, what specifically are you doing to lower the sticker price for the people who actually need drugs? Seniors, cancer patients, and families who face impossible choices. Start with the central contradiction she exposed. On the campaign trail or in sound bites, taking on Big Pharma is simple and satisfying. In practice, changing who pays what for which medicine is a web of statutes, timelines, pricing rules, and industry tactics. That's why Cortez Masto anchored her questions in concrete consequences. Keytruda, one of the top-selling cancer drugs, years of projected premiums for Medicare, and the real-world choices families make when a life-saving drug costs 6 figures a year. Those numbers are not abstract. They translate into treatment deferred, financial ruin, or impossible trade-offs. There are a few policy mechanics worth understanding because they explain why a promise can be hollow without legislative design and oversight. Medicare isn't a single monolith when it comes to drugs. Some medicines are billed under Part B, typically the drugs administered by providers, like many cancer infusions. Others are covered under D, outpatient prescriptions. Negotiation authorities, reimbursement formulas, and cost sharing all work differently across those parts. A headline pledge to lower drug prices only becomes real when the administration uses the specific levers Congress authorized and does so with transparency and sustained pressure for the kinds of drugs that cost the most and hurt people the most. Cortez Masto zeroed in on a concrete policy outcome. Certain top-selling cancer drugs appear to be shielded from negotiation in the latest package she was pressing about. Why does that matter? Because when high-cost specialty drugs escape negotiation, it means the biggest drivers of Medicare spending remain insulated. The result is predictable. Seniors see premiums and out-of-pocket costs rise, taxpayers keep footing oversized bills, and patients who need those drugs may face ruin or rationing. That's the human story behind the numbers she read into the record. RFK Jr.'s responses, vague references to negotiations, and claims that prior programs were poorly structured illustrate the deeper problem Cortez Masto highlighted. Governing requires operational detail, not slogans. Saying you're for patients while supporting provisions that prolong exemptions or carve-outs for blockbuster drugs is a recipe for cynicism. People don't experience policy through White House talking points. They experience it when they go to the pharmacy, open a bill, or decide whether to start a treatment that could save their life but wreck their finances. There's also an important democratic accountability lesson here. Cortez Masto pressed for numbers, projected premium increases, exact negotiation scope, clear answers about what the agency is doing to protect seniors. When the official on the hot seat cannot supply those figures, or answers with, "I think," or "I'm not sure," the public loses confidence. That's not just an optics problem. It makes oversight harder, it creates space for industry influence to persist, and it allows policy contradictions to fester. Finally, remember the trade-offs and the arguments on both sides, because they're part of the public debate you should be able to weigh. Proponents of strong negotiation point to the immediate benefits: lower prices, reduced government spending, and improved access. Opponents argue about innovation incentives and R&D funding, claiming that aggressive price controls can deter future drug development. The point Cortez Masto made is that regardless of those debates, the administration must be able to show how its choices actually benefit patients now, not just promise future fixes while passing measures that shelter the most costly drugs. What should viewers take away? First, watch for outcomes, not slogans. "We'll take on Big Pharma" is meaningful only if you can demonstrate which drugs were negotiated, what savings flowed to patients, and how premiums and copays changed. Second, policy detail matters. The difference between Part B and Part D, between recommendation and access, or between statutory negotiation authorities and executive orders can mean the difference between a real benefit and a paper pledge. Third, insist on transparency. Ask your elected officials for plain language explanations of what specific laws and provisions will do for families in your district. And finally, hold leaders to account. If a secretary can't answer how policy affects seniors' monthly premiums or the out-of-pocket cost for a cancer drug, that's not incompetence, it's a governance failure you should care about. If you want more of this kind of deep but clear breakdown, the politics and the policy explained so you can decide what matters, subscribe and turn on notifications. We'll keep pulling apart the policies that touch your life, not just the headlines. Tell us in the comments, which drug costs have impacted someone you know, and what change would make the most difference to you?